Hi everybody, welcome to This Week in Medicine, October 25th, 2021. Thank you for continuing to tune in. This is brought to you by the Foxhall Foundation. We have a wellness center. We have nutrition consultation appointments. You can email imbalancednutritionpllc@gmail.com. We're just getting started with this. We'll see where it goes. Right now already we've had a pretty positive response. And again, we have a wellness center. We have some active masters classes. We also have classes for kids. We have a variety of classes. You can even email us to ask about the classes that we offer. We have yoga, and then we have a low impact movement class we've changed to key. Key meaning it's key for you to learn how to move and maintain fitness. That class is Monday, Wednesday, and Friday from 12 to 1. All right, so what stressed you out this week? There's still boosters confusion. There's one booster confusion point that I will highlight in particular concerning the J&J vaccine. Air travel safety is still a big problem, especially as we get ready for holidays. So that's another point of stress. It is a good idea to take your vaccine card with you because you never know when you're going to be asked to show that you have vaccination. Vaccines for kids getting a lot closer as of today. Moderna submitted today an EUA emergency use authorization for their vaccine for kids, I believe, starting at age 6. And we already have approval for Pfizer. How to interact with the unvaccinated, we thankfully don't have that problem in our area. We are a very highly vaccinated community in the DC metro area. J&J second shot, yes, you can get a J&J second shot, but as we all know, maybe it's better to mix with a Moderna or a Pfizer booster. So the booster recommendations this week from the FDA and CDC, it's okay to mix the vaccines. Remember, we talked about this in the past couple of weeks. We weren't sure if it was okay to mix the vaccines. The combinations that work, your J&J first shot with a Moderna. Now, is that a 50% Moderna or a 100% Moderna? Actually, the 100% Moderna vaccine was part of the NIH study. I think everybody knows about this study. About 500 people were studied who got the J&J first shot, but were not able to get the second shot because it wasn't approved, but they did get a Moderna. The one they got was 100%. The one that's going to be licensed now for booster is a 50% Moderna. So do we know if the 50% Moderna will be as successful as the 100% to boost J&J patients? No, we don't. If you can get the 100% Moderna for a booster for J&J, do it. If you've already had Moderna 2 shots, don't do it. Instead, if you have Moderna first and second shot, get the 50% booster because a 100% booster is not necessary for you because you already got a superior vaccine. So again, the Moderna 2 at 100% with the third Moderna at 50%, Pfizer 2 at the 100% potency, and the third would be 100% potency as well. Furthermore, special considerations. If you were a woman who was under 50, who got a J&J vaccine, consider not getting the second J&J booster. Now you certainly could, because it increases your protection to 94% to get a second J&J. However, because of the risk of blood clotting, would it be to your benefit to get a Pfizer or Moderna? Yes, that is a special consideration for you if you're a woman under 50. But watch for the menstrual irregularity that can come with the mRNA vaccines, the Pfizer and the Moderna. It is not at all uncommon, unfortunately, to have your menstrual cycle made irregular, typically a heavy period, if you get an mRNA vaccine. We saw this in quite a few women in the past year who got a Pfizer or a Moderna vaccine. It also could happen if you got a J&J and your second shot was Pfizer or Moderna. This typically happened within 3 to 6 months of getting the vaccination. I'm sure there'll be research about this around the corner. Young men who got J&J, consider staying with the J&J. The protection is 94%, so that's still excellent. But due to the myocarditis risk, which we reviewed before, maybe consider staying away from the mRNA vaccine if you're a young man. So this would be a man who is, let's say, 20 or 30 years old. Consider that. Although, honestly, the myocarditis risk was not super high. And the myocarditis or heart damage that you actually get from COVID disease is much worse than the heart damage you would get from myocarditis from a vaccine. That's well studied. Booster recommendations further, you should get vaccinated if you're over 18 and you got one J&J vaccine. Anybody over 18 who got a J&J vaccine, get a booster. If you're over 65, Pfizer or Moderna, get a booster. If you're in long-term care facilities and you're older than 18 years old, if you have underlying medical conditions, in the state of Maryland, they're allowing self-attestation. So that means if you go to get a booster in Maryland, you can self-attest that you have an underlying medical condition. You don't need a doctor's note. I have not read what the conditions are for Virginia. I suspect in Washington, D.C., in the district, it is the same. Self-attestation that you are at increased risk is acceptable. You may get a vaccine if you have an underlying medical condition or if you have an occupational or institutional work exposure. This is the official CDC website page. It's always good to go directly to the source. Primary sources are better. So on the CDC website page, you can Google search this yourself. CDC expands the eligibility as of Thursday, October 21st, so just a few days ago. And there's a full explanation here of who should get a Pfizer shot, who should get a Moderna shot, and further along you'll see who should get a J&J shot. So booster confusion, let's not be confused anymore. If you had a Pfizer vaccine, yes, get a booster. If you had J&J, yes, get a Moderna or Pfizer, depending on whether, maybe, you're a man or a woman, although you don't have to strictly go by those guidelines. Both the menstrual irregularities, the blood clotting, and the myocarditis risk were not super high. Moderna, yes, but get a 50% booster. Don't get the 100% booster. It's not necessary. Soon, they will be giving out a third dose Pfizer. It's been approved. Pfizer says they're ready to send these out. So very soon, you should be able to get your third dose Pfizer for your kids. And then just today, Moderna applied for the emergency use authorization for their children's vaccine as well. Again, Pfizer for kids, they've already submitted it to the FDA. The FDA advisory panel meeting is tomorrow, so we would expect that this is going to be approved tomorrow. Kids should be able to get the Pfizer vaccine at a third dose, 1/3 of the adult dose. And then the CDC would meet November 2nd and 3rd to confirm that yes, the third dose is appropriate for children. So the availability, well, it really might be the first or second week of November. Again, there's similar safety and efficacy as the 16 to 25-year-old age group. The 2 myocarditis studies that I mentioned a couple of weeks ago, really a low incidence, and the cases were mostly very mild for myocarditis from the vaccine. All right, switching off of COVID entirely, did anyone see Melioidosis? Melioidosis, 4 cases reported, but this bacteria, which is native to the soil of southern Asia, was found in these bottles. This picture does not show very well, of Better Homes and Gardens lavender and chamomile essential oil infused aromatherapy room spray. So if you have something that looks like this, you can Google this picture for better resolution and quality. Or if you know somebody who has this room air spray, you don't want to spray it. In fact, the CDC gives direct guidelines for how to get rid of this spray because it had this bacteria, Melioidosis, which causes the disease Melioidosis, Burkholderia pseudomallei. This bacteria is in the soil, not in this country. So why was it here in this country? Because it was manufactured in Southeast Asia, perhaps Northern Australia. 2 people died from this bacterial infection. People who survived need to stay on Bactrim, trimethoprim sulfamethoxazole, which is an antibiotic. It's a very common antibiotic, but you need to be on that antibiotic for I think at least 6 months. This is dangerous. This is a very dangerous bacterial infection. So double bag this stuff if you have it, report it to the CDC, report it to your poison control center. This is bad stuff, look for it. So that leads into how do we make generic drugs? And the reason that I think that the Melioidosis story tips into generic drug manufacture is because these room sprays were made in Southeast Asia. A lot of our manufacturing of generic drugs, in fact, happens in India, China, Southeast Asia. So I cannot claim to understand or know the politics of the PREPARE Act, but to me, it sounded encouraging. I was listening to the radio and I heard a story about VCU, Virginia Commonwealth University, College of Engineering, building a generic drug facility in Virginia. It sounds pretty exciting. A generic drug facility that would make the basic building blocks that we need to make our own generic drugs in this country so that we don't have to outsource them. So again, I can't comment on the politics of the PREPARE Act, but the idea that the United States would be prepared with, again, the active ingredients essential for manufacturing generic prescription drugs is an exciting idea, especially for a doctor's office, where we have had to go through represcribing and unprescribing generic equivalents of many drugs because they were contaminated in their manufacture. So could we in the United States make our own generic drugs? Well, I think this is an encouraging sign that yes, we could. Why do we want to make our own generic drugs? Because there have been recalls for NDMA. NDMA is a chemical that in high enough amounts, regulated by the FDA, in high enough amounts over FDA limits can increase the risk of cancer. It's carcinogenic. We've seen this in metformin extended release pills. We've seen it in the blood pressure pills, losartan, irbesartan, valsartan. These are very common blood pressure pills that actually may even protect us from COVID infection because they block the ACE receptor. So these drugs are very important, but there were recalls over the past 3 to 4 years for, again, NDMA contamination, typically in their manufacture outside of this country. Because in this country, the FDA prohibits certain levels of NDMA from being in the drugs. Zantac, which is a favorite drug of many of you I know, which has had to be replaced by Pepcid or famotidine, was withdrawn from the market for, again, NDMA contamination. It turned out, though, that maybe Zantac wasn't contaminated. Maybe the measuring instruments that were used to analyze the NDMA in Zantac were actually the cause. So it's kind of sad because Zantac was a good drug, and now we don't have it anymore, potentially because of flawed science in discovering if the Zantac actually had NDMA. These drugs, the generics, tend to be internationally produced. None of them are trade name. We haven't had any trade name drug recalls. Read this book if you want to scare yourself even further about generic drugs. This came out right before the pandemic in 2019, Bottle of Lies. It's a review and expose of how drug manufacture happens in generic drugs internationally. It's excellent and extremely eye-opening, and again, it goes back to generic manufacture of drugs in our own country and how we could do that and how it's being done in Virginia, availability of generic building blocks that we need to make these medications, and even back to room air spray that's contaminated with a bacteria from soil that we don't even have in this country. There's an FDA database of recalled generic drugs. This is a screenshot from the FDA page. Metformin was recalled, losartan and other angiotensin receptor blockers, which are excellent drugs, save lives every day, prevent kidney damage, prevent heart attack, stroke, and vascular disease. It's not the drugs themselves, it's how they were manufactured. Rifampin, not many people are taking, but there definitely is a market for rifampin. And then, of course, everybody's favorite, Zantac. So you can go to the FDA website and see the list of recalled drugs. It's extensive. All right, our medical minute this week is about the kidney. We measure kidney function by creatinine. Here are your kidneys. If you will notice, you see the ribs? When I examine you, I put my hands in your back, below your ribs, above your hip bone, because I'm feeling for your kidneys. They're not in the front of your belly, they're in the back. So when I'm examining you, I'm trying to see, does hitting your kidney back there cause discomfort? Is it uncomfortable because you have a kidney stone, a kidney infection? So in the back, under the ribs, above the hip bone. Creatinine is a number that you'll see on your lab test reports. Don't get panicked by this number. It's only an estimate. We need a fast number. We need a number that we can get quickly, that we can generate quickly. So this is a quick generated, very rough number. It is not perfect. It's affected by age. It gets worse with age because our kidneys age. Gender, men have different creatinine numbers than women. Size of the person and how much muscle you have. If you have a lot of muscle, you're going to make more creatinine. Why? Because the kidneys are filters. They filter this breakdown product, creatinine, from muscle. So when you see BUN and creatinine or GFR in your lab reports, please ignore it. It causes a lot of panic from patients. I've had many patients who've seen me specifically because the GFR on their lab report says that they're in kidney failure. We don't use this number. This is a number generated by the labs. We as physicians know how to interpret GFR and creatinine, but unfortunately what is printed out on your lab sheet is not an accurate determination of your personal kidney function. So please do not be scared by the GFR. It causes more trouble than it's likely worth. Exact kidney function is actually hard to calculate. It's a very sophisticated test that we don't use because the amount of time involved to calculate someone's exact kidney function is not reasonable. There's a test called cystatin C that helps clarify whether or not you really do have decreased kidney function. I'll do that sometimes in the office to determine for sure that you really do have abnormal kidney function. And then finally, we'll do some urine testing to clarify whether or not your kidneys are having problems. Remember, the kidneys are big bags of filters, 2 of them. One filter here, and they are bags full of microscopic filters. You actually only need 1 kidney. When we do kidney transplant, we transplant 1 kidney. Again, kidneys, big bags of filters. So here's a big bag. It's made of microscopic filters. The capillaries are just your little microscopic blood vessels going into the glomerulus, which is your filter. Filters out all the good stuff that you need to retain in your blood and shoots out the urine through the ureter. We saw that last week. Don't prematurely age your kidneys. Non-steroidal anti-inflammatory drugs, non-NSAID. That's what we mean when we say NSAID. Non-steroidal, it's not a steroid, it's not prednisone. It is an anti-inflammatory, it's a drug. These are Motrin, which is the same thing as ibuprofen, which is the same thing as Advil. Aleve is equivalent to naproxen, which is equivalent to naproxen. Celebrex is a name brand one. We see this as a generic. Celecoxib and Mobic is meloxicam. These are potent drugs. They don't filter too well through your glomerulus. They'll get stuck there in the filter system. If they get stuck and we can't push them out, they cause kidney damage. These are not good for your kidney. IV contrast dye, when you get a CAT scan, not an MRI, a CAT scan. This IV contrast dye, if you get too much of it, can cause problems. So can a heart catheterization. Although it depends on the type of study, how much of this dye you're going to get, and usually you will wash it out. You just drink more water, make more urine. The gadolinium dye for an MRI, no, it doesn't cause kidney dysfunction unless you're about to go on dialysis. So if you're hoping not to go on dialysis and trying to preserve residual kidney function, don't get gadolinium. But in the meantime, if your kidney function is good, you will excrete the gadolinium. It is not a risk for you. Any drug or supplement in any particular person can be toxic to the kidneys. It could be a heartburn pill. It could be even a kidney protective blood pressure pill like losartan or valsartan. Any drug in any particular person can cause an inflammatory reaction that injures your kidneys. So it's not specific to drugs as much as the anti-inflammatories, but we tend to look at all drugs a patient is taking, including supplements, to try and isolate what is irritating your kidney. Chemotherapy, untreated diabetes, and hypertension, especially untreated or not adequately treated diabetes and high blood pressure, are the #1 leading cause of kidney damage in this country. Don't forget prostate growth. We talked about that last week. If your prostate blocks your urine flow, the urine backs up, goes into the kidneys, and causes kidney damage. This is one of the main reasons why I encourage men, if they have an enlarged prostate or think they might, to discuss with their urologist whether or not there's backflow into the kidneys causing kidney damage. So a real world example of creatinine, usually our creatinine number range normal 0.5 to 1.3. So this guy, look at all these muscles. He has a lot of muscle mass. He makes a lot of creatinine. Plus he's lifting weights, otherwise he wouldn't have these muscles. So he's damaging some muscle. So there's probably a lot of creatinine in his bloodstream. So a normal creatinine number for this guy would be 1.3 or greater because he has so much muscle mass. Let's take this guy. This guy has no muscles at all. He's not making much creatinine at all. He is super skinny. So his creatinine number, because he's not making a lot, so he's not filtering a lot, normal would be 0.5 or less for this guy. So again, these numbers need interpretation. Remember from the previous slide, based on age, gender, how much muscle mass you have. I can help you interpret that if you're interested. If you're a very small person without much muscle mass, you're going to see a lower creatinine. That's normal for you. But for example, if you're a very large person and you have a very low kidney number, that might mean that you have excellent kidney function because we would expect it to be higher. So there are many ways to interpret this. Ask me, I can help you look at it. Tony's tip of the week, learn how to use your cell phone camera to send us pictures. I really can diagnose shingles. I can diagnose erythema chronica migrans, which is the rash that comes with Lyme disease, sometimes. I can diagnose serious skin infection sometimes. So if you take a picture, I should be able to tell you from the picture, ballpark estimate, do you need to go to the emergency room to get an abscess incised and drained? Do you need to get an appointment with your dermatologist? Do you need to get an appointment with me? Cell phone pictures are very useful. They're confidential because you send them to info@foxhallmedicine.com. And it does expedite getting a diagnosis, getting you on the right treatment, and most importantly, avoiding the emergency room. So you take a picture, you select the picture you want to send to me, On an Android phone like a Galaxy or a Samsung, this is what the share icon looks like. So you click on that, then it will open up a box for you to enter the recipient, which would be info@foxhallmedicine. Or if you have an iPhone, this is a share icon and this is a share icon. So just click on those, type in the recipient for the email, and send us a picture. Fast pitch, get your annual mammogram. We're almost out of October, so Breast Cancer Awareness Month will be over soon. Get a booster if you got the J&J vaccine, you're over 18. Consider a Pfizer or Moderna booster if you are at risk. And it's okay to get the flu shot and one of these vaccines together as a booster, but think about your side effects. Some people are really getting significant side effects with their booster shot, so you don't need the additive effects. If you have the time, and certainly flu shots are available widely, just go ahead and separate them by 2 weeks. So in case you get side effects from your COVID booster or your flu shot, you're not causing yourself unnecessary additive side effects. Again, remember your health pyramid. If you don't get your vaccine, the whole pyramid tips over. In our book, You Can Prevent a Stroke. There's really no such thing as heart disease. It's mostly just natural aging. Let us help you with that. We have the window into the future of your vascular disease risk. Just ask us and we can help you understand it. Thanks.